the advance. Okay, as the last speaker before lunch, I have the burden, really. And I first want to say thank you to you all for sitting patiently through all this, and thanks to Jonathan for inviting me here and for his provocative introductory remarks. I am an economist, and I work for an engineering and architecture firm. We do a lot of cost-benefit analysis for federal, state, local clients, and you know, I think I probably fall into the realm of being an economist from a traditional perspective, but it's largely because oftentimes maybe the power of our megaphone of saying a benefit cost analysis of 1.2 makes the project viable is a challenge for us. And we tend to be evidence-based, but I think maybe when we first met, I think maybe Jonathan was struck by some of the work that we're doing to recognize uncertainty and to broaden or incorporate more of the emerging work that many of you are doing, and many of the speakers before me have remarked on what is the evidence and how can we incorporate it into in decision making, particularly with respect to design and influencing people's choices. So a little bit about economics. We are, you know, it's an objective approach. We want to make sure we identify the sources of the benefits and compare them to the costs. They have to be incremental, which means we have to understand what the baseline level of physical activity is and how might these design changes improve the long-term health. Okay, so one of the things that we've been doing is this sustainable return on investment approach, which is really trying to reconcile and look for all the evidence in all of these three dimensions of the triple bottom line. And health is a real one, and it's in fact we incorporate a lot of health effects. I will talk about that in a little bit, but and we turn those into monetary values. We recognize also the intangibles. We do a lot of multi-criteria analysis, which is really more getting at a cost-effectiveness measure, where you know how much the bike trail costs. You may not necessarily know how many people are going to use it, but you think it's going to change some behavior. Those are all good ways of designing. And the double counting comment there is, you know, some of the work that I've been doing on livability for U.S. Department of Transportation and EPA is, you know, trying to reconcile, well, we've been monetizing the value, the time savings, even at the 30-second point as some kind of value improvement for expanding your highway, right? Or taking transit. And so the double counting part of that is that we also are recognizing that people are willing to and interested in moving in more densely populated areas where you're going to walk more. Okay, so the price difference in the property values near the transit is higher, but it's you know, it's also takes into account the transportation value. So we're in the trenches and trying to understand what that value, that incremental value is of health, and this risk and uncertainty part is you know, enables us. We may not be exactly right, but we can be approximately right. So those are some of the principles of how we do our work. This slide just shows you that there's the mechanisms of comparing the benefits in all these different measures of how much we actually pay for things or can appreciate in terms of time savings or reliability, and as well bringing in the health effects from reduced air pollution and water contamination and productivity, things that may not necessarily show up in a you know, a financial bottom line, but can be compared against costs. And this is some of the burden of the public agencies to design things that are going to be of interest and of value by public, even if they don't recognize it themselves. So with health effects, there are a few different types of costs. We've heard about some of these already, direct, indirect, and intangible. The direct and indirect are in some of the literature that I read are pretty well established. For particulate matter, Jonathan mentioned that earlier, we monetize the long-term health effects both in terms of reduced life years and quality adjusted life years, as well as some of the productivity losses. Same thing for indoor air quality. Some of the emerging work is in these intangible factors, well-being research, and the linkages between how we are measuring and responding to surveys on what we feel about our life, and how that translates into, some monetary value that we can then include in these benefit cost analyses. I would think more of the challenges have to do with really trying to understand the magnitude of the impact. When you build the bike trail, how many people are actually going to use it? And how is that increased activity going to reduce their long-term health effects? Some of the things that we tend to worry about. Now this slide really, attempts to provide a little bit of the evidence that we can draw from in the different types of effects that infrastructure has. So generally speaking, there are direct effects and ways in which infrastructure influences choices. With direct effects, we've designed buildings that may make you walk further to, I like that example earlier, may make you walk further to your office, as well as inside the building and your HVAC systems, the number of times you have to get clean air in there. There is evidence to the effect of productivity enhancements, these indirect costs. Similarly, in urban areas, it's full of impervious areas, and the stormwater runoff can cause bacteria and other contaminants into the water system, and if we're not designing our water treatment systems, we can be subject to health effects, both in terms of lost days at work, as well as morbidity, mortality. So there's evidence out there that check mark indicates that there's for a certain type of design and system, there's some evidence that we can incorporate into economic analysis. Now, on the personal choices side, what we do with our transportation system influences the amount of pollution that's generated, and there are long-term health effects as well as productivity impacts that can be incorporated into cost-benefit analysis. And on the physical fitness side, the long-term health effects are certainly, there's evidence in that, and we incorporate that into our analyses. We've done a number of different projects on statewide bike plans and even local the bike trails. There's a project down in Atlanta. They're trying to circumnavigate the city with a big bike trail there. The intangible costs are not as clear, but they certainly, I think a lot of what we've been talking about here is the enhanced psychological and beneficial feelings you get when you're more physically active, when you take the stairs up to your office. And the last one here is this livability question, and how living in and around in other people and in cool spaces like Times Square and some of the other small parks, how does that affect our long-term health care, and how does that, and the cost associated with that, and as well as the psychological well-being effect. I think it's emerging, the science and the evidence is emerging, but it's certainly some of the burden that we face. My profession faces is the burden of the spreadsheet, is that we really kind of have to quantify things to make them, to incorporate them into our 1.2 analysis of the value of the infrastructure. So, fundamentally what we need to understand is what is the change in behavior? What is the change then in the value or the physical condition, the health of someone who has their behavior changed by, designing the parking lot further away, or designing a parking space or a park that a child will drive his tricycle around. So that's it for me. I'm going to be brief so that we can get to more of your questions and comments. Thank you.